probably seen the Tiffany plate everywhere. Half veggies, a little protein, some whole grains. It's colorful and it's Instagram worthy. Why the nickname? Because, like a box from Tiffany's, this version of healthy eating is polished and maybe even elegant. But it's definitely not built for your post-op or GLP-1 reality. After bariatric surgery or on a GLP-1, your anatomy, your hunger signals, your nutritional needs are completely different. Don't go anywhere. In today's episode, Gail, Isabel, and I are exposing why the so-called Tiffany plate can sabotage your results and exactly how to eat to protect your muscle, energy, and results long term.
Say goodbye to chalky calcium chews. ProCare Health makes chews that are creamy, not gritty, and packed with food-based TrueCal for superior absorption. Now available in peaches and cream. And yes, it tastes as good as it sounds. Save 10% with code BSS10 at ProCareNow.com.
I'm bariatric dietitian Dr. Susan Mitchell. You're listening to the Bariatric Surgery Success podcast. So glad you're here today. It matters where you get that nutrition information. Here's what you need to know now. Joining me are your favorite expert bariatric dietitians, Isabel and Gail. These two stay up to date. They know what's going on when it comes to bariatric nutrition. Isabel Maples, the bariatric coordinator at UVA Health in Haymarket, Virginia. Gail Smith, the bariatric dietitian at the Weight Loss and Bariatric Surgery Institute in Orlando, Florida. You can find both Isabel and Gail's contact information in the show notes. Hello, friends, Isabel, Gail.
Hi,
Hello.
both of you.
That's Tiffany Plate is having its moment.
Yes.
Just like any other food trend. You know, I like it because it's real food. That's a nice change. It's colorful. It has variety, all the things we dietitians love.
And all 5 food groups.
But at the same time, there's no real plan, just someone's preferences who's made this up. So it looks good in theory, but it's not built for real life bariatric surgery. Why? It prioritizes variety and aesthetics, but not clinical necessity, like protein first or low volume due to surgical changes. It's actually counterproductive for bariatric surgery and GLP-1 users. And I'm all about strategic eating for success. So look at it this way. The bariatric plate is an enhanced version of the Tiffany plate. It's designed for your need and your specific way of eating. So let's get into the weeds and let's compare the Tiffany plate against what we'll call a bariatric plate or a GLP-1 plate.
Well, you're right. The Tiffany plate has great visual appeal. And what it recommends is your plate look like half of your plate as vegetables, low-calorie vegetables like carrots and cauliflower, broccoli and Brussels sprouts, and maybe lettuce, some of those low-calorie vegetables. A quarter of your plate as lean protein from dairy foods, from meats, and also have a quarter of your plate as carbs, either like grain foods like rice and pasta, breads, but also starchy carbohydrates like potatoes, and a serving of fruit or dairy on the side. So actually dairy doesn't count, dairy separate. But so this plate is similar in a way to my plate. It used to be the food guide pyramid where you've got all the different food groups and they're broken up into portions. But my plate requires a normal digestive system. It assumes that, and normal amounts of food that people can eat. And it's great for preventing disease, promoting health. But those factors, like your digestive system, really make a difference. And that's why after bariatric surgery, the portions and the proportions need to shift of those food groups.
Agreed.
Yes. And so the bariatric plate, which I tout every time I have my class and talk to my patients, is perfect for them because it's about 4 to 5 ounces. Okay. It's the size of their stomach. So we're talking half of the plate is going to be their 2 ounces in the beginning of protein. And the other half of the plate is going to be mainly 3/4 of it's going to be that free veggie. And maybe just a tablespoon or two is going to, in the beginning, is going to be the starch choice, the carbohydrate choice, which
And you
would
know,
be
I'm just thinking based on what you're saying right now, when you look at that Tiffany plate, it's like a charcuterie board.
A
I
grazing
mean,
yes,
board.
it's a big amount of food. And yes, it may be, it's all healthy, colorful foods, but totally a tray full of food compared to what we're talking about right here, right?
exactly. This is just small. And the patients are going to get that protein in pretty much first, but they don't have to eat it all first. But that's our recommendation. Get your protein in and then take a bite of your vegetable. Don't eat all the
Exactly.
protein, but, mainly
Well,
get work on that.
yeah, and when
And
they're
then,
first starting, they may have to eat all that protein, but as they know that they can get the minimum amounts of protein, then they can eat some protein, then maybe alternate the protein and the veggies to make sure they're getting in what they need.
yeah, I think it's so important to know that my plate designed for just the healthy
Hmm.
population, that this is designed on clinical guidelines based on bariatric surgery itself, based on using ELP-1s and how they change your appetite and desire to eat, and from guidelines that come from the professionals that deal with these things, just like you guys, every single day. They're very specific. They recognize that small little pouch. They recognize the risk for protein, calorie, nutrition, malnutrition, things that are very, very important in these situations, right?
Yeah, and
Right.
I'm going to say what our listeners have heard us say so many times: protein, protein,
Protein.
Protein.
protein. Yeah,
Absolutely.
because
And that
whether
is not what you see on the Tiffany plate. And
well,
that's a huge, huge difference.
and whether you are whether you've had surgery or on a GLP-1 weight loss medication, your appetite's low, and both situations you've got to prioritize protein. Why? Because if you don't get enough protein, we know there's going to be more during periods of rapid weight loss. You're going to lose protein from muscle, and that's going to actually eventually make you less healthy by lowering your metabolism. And it's not going to be the look you want. If you can maximize that protein, that muscle as you lose weight, that's what getting enough protein will do for you. That and strength training, but we'll talk about that in another session.
Absolutely. These are equally delicious and based on eating real food, which we love. But with bariatric surgery and GLP-1s, you have to consider things like dumping syndrome, altered digestion, change in appetite. So let's get even more specific as to why the bariatric plate wins in the real world over Tiffany plate if you've had bariatric surgery or you're doing the weight loss medications.
Your stomach capacity, as we keep saying, is only so big. You got to get the protein in there for satiety and to help you, as we've said, for not losing protein and preserving your muscle mass and losing your fat mass. But you also have to worry about glycemic index, your glycemic reaction, your hypoglycemia. You can't have a bunch of fat, dumping syndrome. You can't have a bunch of sugar, carbohydrate only. You're going to have your blood sugars go crazy. So you want to focus on a certain amount of satiety, right? So you're eating every 3 to 4 hours instead of grazing on that Tiffany plate every 30 minutes. You can't do that with bariatric
I
surgery.
want
You
to
got
ask
to
a question because
go
you
ahead.
said something that I think people forget about, and that is we always talk protein, 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 and prioritizing that because of the small volume. Remind everyone how much volume their meals should have after surgery, A, and B, does that volume, is it always that way? Does it increase ever? How do you all guide your patients for that volume? Because I'm thinking that compared to this charcuterie tray of food versus the reality of either A, not much appetite on a weight loss med, or B, surgery where the volume
Yep.
is small.
Yep.
So what
Yep.
is the volume that you guys are focusing on?
We're focusing small in the beginning, but I tell them over time, your stomach is going to relax a little, not stretch. We don't want to stretch it with carbonation, stay off of that, but definitely eat that small amount. And patients tell me, don't worry, Gail, I get full. I'm full. If I overeat, I'm throwing up. So
Yeah.
over time, you can eat a little more, and maybe then you can have some more of those free veggies, or maybe that carb choice as a fruit or a bread or cracker, or a little bit of fat, olive, or healthy, avocado, a little slice with your avocado toast. But be careful. A year out from surgery, patients may be able to eat a little bit more, but they still get full. They do have to listen, right? Yeah,
Okay. The transition in the amount of food that people can eat is quite different from a month out from surgery than 12 months out from surgery. They're going to be getting full off just a couple of bites of food or maybe 2 tablespoons of food initially. And they're going to be able to eat more than a cup of food that far out, further out from surgery. So it'll vary. And with weight loss medications, it might be more consistent. But as your portion size increase in the medication, your portion size of food may also be affected as well. So the bottom line is that I tell people is to use their fullness cues as a trigger to know when to stop eating. And that might be difficult at beginning because may feel different, and
Yeah.
people might
Again, I
not
agree.
feel able to trust their fullness. But one thing
exactly.
that's clear is that if you get over full, then you're eating too much. And sometimes
Exactly.
just one bite can make the difference between comfort and discomfort.
Isn't that interesting what you just said? Sometimes one
One.
bite can make the difference in comfort and not.
And that's why slowing down to eat the food and eating all at once within a 30-minute window is allowing your body to use the fullness that comes from structured eating. And that's why that structured eating rule is there, where you sit down to meals and
Right.
snacks and don't graze. Which I worry that the Tiffany board is the Tiffany plate is like a grazing board, and that people may keep nibbling
Yes.
on it because hey, it's all healthy food, right? So they want to keep
Right.
eating on it. But
It's a
In fact,
buffet.
I wanted to bring that up because I'm thinking about that large amount of food on the Tiffany plate and how that compares also to much less of an appetite with a GLP-1. So we
Mm,
know the small pouch after surgery and what you've just said, you don't want people grazing, but I'm also getting a lot of questions about how do I structure meals when I'm just not hungry? I have zero appetite on this GLP-1
mhm.
medication. So appetite can feel really different on a GLP-1. How do you respond to that
it's
versus the
it's the
grazing
same.
situation?
They just have to try to eat a little bit and
Mhm,
always have some protein, definitely
mhm.
too, because that can help them just to make sure that they save their muscle mass, but also give them the satiety. It does still help whether they're just starting or they're
Mhm.
6 months down the road or they're off now. They're off the GLP ones. They still have to practice that healthy eating habits.
And so that
Okay.
structure in meal planning, I mean, it may
Yeah.
sound like a simple concept, but it is crucial because it really
It
lets you
is,
take advantage of the fullness that comes with a smaller stomach or with the
right?
lower hunger and still be able to meet your
Yeah.
nutritional needs. So I'm talking eating 4, 5, or 6 times a day. I don't mean grazing.
Yep.
I don't mean skipping
Mm-mm.
meals. My
Mm-mm.
rule is that you have to wait at least 2 hours after you eat before you eat again, and that you don't wait more than 4 hours between
Mhm.
meals or
Right.
snacks.
Agree. But
And,
I always say 4, 5, 6 too.
yeah. And, people aren't going to eat a whole lot at one time. So eating more often like that is going to allow them to do that, but to get more nutrition in, but also get in that pattern where they can better judge how much to eat so they don't get uncomfortable, but then they're ready to roll when the next meal or snack comes around too.
Exactly.
Good information. Okay, as we wrap up, anything about the Tiffany plate versus the bariatric plate and the GLP-1 plate that we've missed that you want to share? What would be your most important take home message?
Well, I certainly want my patients to worry less about Instagram worthy and more about getting down to the bariatric nutrition basics, eating slowly, getting the protein in, the gradual transition in the texture so that they are more comfortable, they meet their nutritional needs, and they set themselves up for some really good habits while hunger is low so that they're successful down the road long term.
Yeah. And you can look at that Tiffany plate, that charcuterie board, and also think when you're on a cruise ship, when I'm at a restaurant, when I'm at the dinner table at someone else's house. You still have to practice that control. What should my plate look like? I know it in my mind. And definitely try not to drink and eat at the same time so you have a more successful, comfortable eating.
I love it. Good information. Thank you both for taking your time today. Come on the podcast to clear up the differences between these two plates and to clarify why this strategic eating wins. I really appreciate your time.
Great to be
Thanks,
here.
Susan.
Okay, so here's what I want you to do this week. You just heard the big differences. If you need to listen again, go back through the podcast and really take notes and pay attention. But it comes down to getting in your protein, the small portions with the focus on protein versus the great big plate with a lot more carbs. So if you just remember, eating the way that's designed for your specific body, your specific system, it's all about you. So eat the plate that supports your success, as Isabel just said. And before we go, if you've been dealing with stomach cramps, sweating, nausea, dumping syndrome, it can completely ruin your day and derail your weight loss. So I'm sharing 4 top tips to help stop this unpleasant condition. You'll discover these simple strategies to help soothe your stomach and get your day back on track. So you can grab the freebie right now at breakingdownnutrition.com/dumping. And remember, you are worth it.
Bariatric Surgery Success with dietitian Dr. Susan Mitchell is produced and owned by Practicalories, LLC. All rights reserved. Remember, the content provided on this podcast is for information purposes only and doesn't create a patient-provider relationship. It's intended to provide reference material and is not designed to provide medical advice. Please consult your healthcare provider regarding any medical issues you have relating to symptoms, conditions, diseases, diagnosis, treatments, and side effects. Podcast guests express their own opinions, experience, and conclusions which do not necessarily reflect or agree with the host, Dr. Susan Mitchell or Practicalories, LLC.